everyone, welcome to the Leela channel. I'm Star, a member of the Leela team, and I'm very excited because today I have the honor of interviewing Dr. Navya Mysore. Navya is a family medicine physician, and today we're going to be asking her questions about her personal approach to treating pregnant and new moms. Navya, thank you so much for being here with us today. Before we get into the questions, I just wanted to ask you if you could share with us a little bit about yourself and the type of medicine that you practice.
Totally. Thank you for having me. This is really exciting to have talk with you guys. So I'm Navya, and I am a family practitioner. I was born and raised in Montreal, and I did my med school at McGill, followed by my residency in family medicine, and then I did a fellowship in women's health and in pediatrics. So I was practicing in Montreal for about 7 to 8 years, and really sort of the full spectrum of family medicine and what that brings. And then about 5 years ago, moved to New York. My husband ended up getting a job here, and that was the reason for the move. And initially, I was a little hesitant to see how it would work working in the US healthcare system, but it has been a pretty good transition. And now, for the last 4 years, I've been working at One Medical, where I am a primary care physician, but I also practice quite a bit of women's health, and I'm super passionate about it. And I'm also really passionate to work with female led brands that have a great initiative. And so I'm really excited to be here talking with you guys.
Thank you so much. We're so excited to have you as well. So on that note, we really wanted to ask you about kind of your collaboration with patients because you really do believe in working collaboratively with your patients and developing strong relationships with them. So how do you go about this when you're treating pregnant women specifically?
Totally. Yeah, that has really been my practice style since I started seeing my own patients during residency. It was sort of how we were trained, and that sort of I just sort of continued ever since I was practicing in Montreal. As a family doctor, I mentioned this before, I was very much in the true sense of the word, taking care of parents, babies, and their grandparents, really full spectrum. So, I would have a patient who would get pregnant, I would follow the pregnancy, then do the delivery, and then follow the newborn, and then the grandparents, and you really get to know a family at that point. You understand each family dynamic and how to approach their health based on that. Every person is a little bit different, and how you speak to them and how you develop that trusting relationship is going to look different. And that's sort of how I caught on to this, that this actually worked really well. I was able to form trusting relationships and realize that this was helpful in having patients change some of their lifestyle behaviors and actually improve or prevent any kind of health issues. And this has sort of been what I've continued to do in New York as well. And initially I thought maybe there might be a change moving from Canada to the U.S., but this sort of method has really proved well.
Yeah, that's so great. I feel like I've had so many personal experiences where like doctors weren't necessarily didn't have the best like bedside manner. So that's like so awesome to hear that you have that approach, especially to treating pregnant moms. Um, so what sort of inspired you to take this kind of approach to treating your patients and like why is it so important to you?
I think it's important for me because of just sort of over time when I was seeing patients like this and using this method, I was realizing how much of a strong effect it had. Patients really like I found that they were changing their habits, they were improving their health, they trusted me more, and likewise I felt like I was developing a stronger relationship with my patients. So it was a two-way street in the way that I felt patients were happy because they felt like they were heard. And I was really happy going home feeling like I had really established a connection with my patient and was able to help them in some way. So that's partly how it started, and then that has continued over the years.
That's great. So as a new mom yourself, has this changed your perspective on maternal health or changed the way that you approach treating your patients at all?
Oh my God, absolutely. When I was looking for an OB, I wanted someone who practiced similarly to myself in the way that I could feel comfortable, develop that relationship, and have those sort of candid conversations with. And I ended up finding that OB. There was a bit of a journey to get there, but I ended up finding an OB that was like that, and that really reinforced how I wanted to practice. And also just going through the pregnancy yourself. Like prior to being pregnant, you almost look at pregnancy as this black and white aspect, and I was really found myself counseling and tr- and personalizing my approach, but still my recommendations were pretty rigid in the way of like I knew what was safe and what was not safe, but I didn't understand that how nuanced pregnancy can be and how many mixed emotions you feel through it. And so going through it now, I realize like, wow, I've totally like revamped how I counsel or how I talk to my patients who are pregnant because there's so much to it than just the pregnancy itself.
Yeah. So I guess kind of on that note, if you're comfortable, would you talk a little bit about your experience with wellness, particularly mental and emotional, as you transitioned into motherhood?
Yeah, it took me a while to feel comfortable talking about my mental and emotional experience during my pregnancy, but my first trimester was pretty rocky. I was nauseous. I had a few complications at the beginning, and my initial OB, who I was with, definitely wasn't the right fit for me. I had a very hard time connecting. I was rushed out of appointments. I really feel like I couldn't ask all my questions. And at that time too, when you're really early on, like you haven't told your employer, you haven't told many of your friends or your family really, because you're just worried that maybe there could be a possible miscarriage. And I began to feel really isolated from everyone and not having someone to really talk to. I mean, obviously my husband was super supportive and was there for me, but it's different when you can talk to someone who's been through it, or if you feel supported by your healthcare provider. And this was just not really how I was feeling. I ended up finally reaching out to a doula who was really the changing factor for me. I felt like I was suddenly so much more supported. I was working through some of the medical issues and then ended up finding another OB who was just phenomenal. And I had such a great experience with her. I was able to develop that trusting relationship that continued throughout the pregnancy. And really, it makes such a difference in terms of like how you feel, how secure you feel, especially as a first-time mom. I think it makes a huge difference to have that kind of support. And then, into my second and third trimester, I really did feel like my mood leveled off in terms of my hormones, and I felt a little bit better because I felt supported. But definitely in my first and second trimester, there was definitely some touches of perinatal depression, and it was not an easy period of time.
Thank you so much for sharing that with us. It's really helpful for pregnant moms and new moms who are going through those kinds of struggles to hear the stories of other women who have gone through it as well. So we're really grateful for you that you shared that with us.
Oh
Um,
yeah, absolutely. I mean, I'll just say one more thing about it. It's often when we get pregnant, there's often this feeling of, oh, you have to be this glowing pregnant mama who is really embracing the journey of pregnancy. And yes, there is part of that you do enjoy some of the journey, but sometimes you don't. And sometimes it can be really rocky and it can be really hard, and you might be like, I don't really like this, and that is okay. It's okay to say that. It's okay to accept that. And I think we need to be more open as a society in terms of saying that, what, pregnancy all that isn't always rosy. And when you need the help, to feel like you can reach out for it, whether that be through your doula, whether that be through your OB, through friends and family, through a therapist, not feeling alone through this can be really helpful.
yeah, for sure. Thank you so much for saying that. It's so helpful to hear. So yeah, thanks so much for being with us today. Be sure, for those of you watching, thanks so much for watching. Be sure to